Very good evening, all of you, and welcome to the INI SETI Ophthalmology Recall Questions. I hope your paper went well, and I think that was a very good paper because very easy paper is also not a good paper because it cannot distinguish between the people who have studied and those who have not studied that much. So all those people have put in the hard work. They always want that slightly tougher paper is better, and I think they live up to their expectations. They give quite conceptual questions, but one thing which I liked is that they did not give any controversial questions. They did not give any awkward questions, any wrongly framed questions that came last year, or the incomplete choices. Like last year, they had not given the concentration of pilocarpine, and two of the options were just the pilocarpine, so that was not there. And all the questions were there from the class notes. So whatever questions I could get from you people, from your recall, by your help, along with the most probable options, I have tried together. Thank you so much for cooperating. And good evening, Jitendra, Riya, Anuram. I welcome you all, and I heartily thank you because you people have contributed a lot. I wanted to come up with the most probable questions, the right language, the right options, and if there's something wrong, please do forgive me, and please also correct me in the comment section so that I can do the corrections, and I will share the corrected PDF also. So let's begin, guys. Right? So with each question, please let me know also that is this question right or not, and any of the options, if you feel that that was not there or it was slightly different, please do let me know. Right? So the question number 1 is the retinoblastoma most commonly spread via. So I think this is a very, very direct question. We had discussed this in our class notes as well as in the app also, that all the 4 routes we can have for the spread of retinoblastoma, and some of you were actually confusing with the blood spread. No, blood spread is not the most common. It is always through the optic nerve. Yes, now if optic nerve would not have been there in the options, then you could have gone for the direct spread. But because optic nerve is there in the options, a better answer will be the optic nerve here. Alright, so your answer will be optic nerve, and as told by the maximum people, you people have also gone for the optic nerve. So that is a better answer, yes, but some of you were confusing with the direct spread. So if direct spread was there but optic nerve was not there in the options, then the better answer was the direct spread. And if you look at the hematogenic spread, so it is of course not the most common, but hematogenic is actually most common source of death. Most common source of the death in the children having the retinoblastoma, especially if it is spreading to the liver. So if it is spreading to the liver, then the hematogenous spread is the most important one, and it is also the most common cause of the death in the patients of retinoblastoma. So I think this always remains a good evening, everyone. Good evening. So is there any correction in this question? Please let me know. I think this was one of the direct questions. We always discuss this. The spread can be a direct spread, or it could be a distant metastasis. Distant metastasis could be the lymphatic spread also. It could be a blood spread also. And the blood spread is the most important, means dangerous one, because mostly when it is spreading through the blood, it's going up to the liver, and that becomes the most common source of the cause of the death of the children. So as I always say, intraocular tumors are important, and they tend to give the question, and this time they have given you a question on intraorbital tumor also and the intraocular tumor also. If you remember, we always discuss this chart in the classes also, that when we have the tumors in the eye, whenever we have the tumors in the eye, you always have to see that whether it is the primary tumor, and then we have got the secondary tumor. Secondary tumors are always most common, which are your the metastatic tumors. Metastatic tumors are the most common one. But whenever they are asking you with respect to the primary tumors only, then you have to see whether they are asking about the orbital tumors or whether they are asking you about the ocular tumors. So it could be intraorbital also, intraocular also. And in both of the cases, the age group is important, whether it is found in the adults or whether it is found in the children. So intraorbital in adults, this is your cavernous hemangioma. You remember this? This is your cavernous hemangioma. Then we have got intraorbital in children. So this is your rhabdomyosarcoma. Intraocular in adults, this is malignant melanoma of the choroid. And intraocular in children is of course the retinoblastoma, right? So you have to always remember this. This is again important. Happy ophthalmology, very sweet of you, yes. Borelli, I could not get this question actually. I was asking this, that what was the question on neuromyelitis optica. Please give me a total question if you could give me. Right? So this was your question number 1. Coming to the question number 2. Question number 2 is again related to the tumor where you have proptosis. And if you remember, I told you that proptosis is important, and I also in the last minute revision, that last leap for the INI-CT mein, I had discussed whole of that proptosis, that if you are having proptosis along with the URTI, if you are having proptosis along with the bleeding epistaxis, then what are the incidences. And here they asked you proptosis quite in a straightforward manner, Desmin positive tumor. So what's the answer, guys? Can you tell me? Is it the rhabdomyosarcoma, leukemia, lymphoma, or the Ewing's tumor? So what is your answer? Let us see. We will have a quiz on this also. So what did you mark there? Proptosis with the Desmin positive. So Desmin positive means it's a muscular tumor, and therefore the answer to this question will be your rhabdomyosarcoma. So it is quite obvious and quite straightforward, right? Any confusion, anything that you would like to change in this, any of the options, if you feel like that it was different, please do let me know so that I can give you the corrected one also. All right. Then coming to the next one. Now here very good. Yes, it's A. So I got this picture. I do not know if this was the exact picture, something like this. They were saying, you people told me that they had given, and I'm sure that it was a picture of homonymous hemianopia. It was a picture of homonymous hemianopia. I do not know whether they gave it on the right side or on the left side, but we will consider any side, okay, how to do it. So whenever you are doing a question on the visual field, you have to consider that as if it is your field. So your right side will be the patient's right side here, and your left side will be the patient's left side. So that means there will be right. So this will be the right side. And you can see the central sparing, because all of you told me that that was right or left homonymous hemianopia. Along with this, we are also having the macular sparing. Can you tell me why do we have this macular sparing? Why do we have this macular sparing, and where do we have this macular sparing? What is the blood supply of the exact picture? Oh wow, thank you so much. So you people shared me the exact picture. All right. So this picture came, and I think this picture I had shared with you in the last sleep of the NEET also, and it came in INI-CT. Right sided, है ना? तो right sided था. है ना. So we have got the right homonymous hemianopia है, along with the central macular sparing भी है. So which area will show me this defect where you are having a homonymous hemianopia along with the macular sparing? And why do we have the macular sparing? If you look at the blood supply of the visual cortex, ठीक है. If you look at the blood supply of the visual cortex, then we know it is the posterior cerebral artery, ठीक है. But macula is different, and macula has the double blood supply. So what is the double blood supply of the macula? If you remember, I always tell you M for M. So we have posterior cerebral artery along with the middle cerebral artery. So due to this double blood supply, we have got this macular sparing. If I have a defect only in the posterior cerebral artery, then I'm going to have this macular sparing. So where do we have? Whenever I am having a defect of the visual cortex, where do we have the visual cortex? In the occipital lobe. And what are the Brodmann areas? Yes. So what are the Brodmann areas? The Brodmann areas here are your 17, 18 and 19. ठीक है ना? Now the thing is that if you are having this macular sparing, we are very sure, right? If you see, this has again discussed in our class notes as well as the app. That means I am not having the lesion of a chiasma. I am not having the lesion of the lateral geniculate body. Now, who will tell me, is it a right-sided occipital lobe lesion or a left-sided? Let us see this. Yes. Very good. Very good. Very good. Awesome, guys. So, now it is a right homonymous hemianopia with the macular sparing. So, which side occipital lobe lesion it is? Yes. So give me the option, is it left or right? Let us see that. This is left or right? We have a lesion of the left occipital lobe या फिर right occipital lobe. यही tricky है, and that is why I think examiner gave you both, है ना? Both left and right. Otherwise, you would have marked just the occipital lobe, seeing whether it is right or not. Yes. Yes, because we always have contralateral homonymous hemianopia. We always have the contralateral. So contralateral है, and they have given you right-sided. Very good. So answer will be left occipital lobe. थोड़ा सा tricky था. If you do not see this, that it should be contralateral, then you may have landed up in giving the right-sided. So this is very, very important. ठीक है? All right. So this was the next question. Then again, simple question. Yes, exactly, Jay. It is opposite side. ठीक है. Now the next question is most common lacrimal gland tumor. A very, very easy question and a direct question from the class notes, right? So please check the options, because 3 options most of the people gave it to me, like pleomorphic adenoma, mucoepidermoid carcinoma, adenoid cystic carcinoma. Some people said the 4th option was basal cell carcinoma, and some people said it is a non-Hodgkin lymphoma. So please, can you tell me this, that what was the 4th option? Was it this basal cell carcinoma, or was it a non-Hodgkin lymphoma? Please help me with this. And answer is very clear, because it is not that. The most common lacrimal gland tumor is the pleomorphic adenoma, which is actually lymphoma was there. So basal cell carcinoma, I think, was not there. Pleomorphic adenoma is a benign tumor. So when they are asking you the most common, rhabdo था इसमें. And if they would have asked you the malignant one, if they would have asked you the malignant tumor, then the answer was your adenoid cystic carcinoma. Nevertheless, I think non-Hodgkin's view people are saying, so no, we will cut this. But because the answer is something else, so it is not bothering us. We will cut this, right? It is the non-Hodgkin lymphoma. So we have got a pleomorphic adenoma, which is all over most common. And if you talk about the malignant one, then it is the adenoid cystic carcinoma. ठीक है ना? अच्छा, what if they would have asked you the lid tumor? जैसे lacrimal gland tumor पूछा, they could have asked you the lid tumor also. Then what would have been the answer? Let's crack that also. Lid tumor में what is the most common? Benign. And what is the most common? Malignant. ठीक है, most common benign and most common malignant अगर lid tumor में होता, then benign में it was your papilloma and malignant में it is the basal cell carcinoma. So if it would have been a lid tumor, then the answer would have been papilloma and the basal cell carcinoma. Then there is another question related to this. The most common in the recurrent calazion. What is the most common carcinoma which can occur in the patients having the recurrent calazion? So all those people who have got the problem of recurrent calazion, they will have the sebaceous cell carcinoma. So we have got the most common lid tumors, benign hai, malignant hai, most common lacrimal gland tumors, benign and malignant, and the most common tumors also in the recurrent calazion, that is your sebaceous cell carcinoma. Then you have also seen the tumors of the intraorbital and the intraocular area. So any of the overall most common was asked. So overall अगर most common पूछा है तो benign is more common. So answer will be pleomorphic adenoma there. Yes. I think बाकी options are correct in this. Nothing to worry about it, है ना? Okay. Now again a question where I'm not sure that exactly what picture was asked, and what I could get is the identify the block. The options were the nasociliary, anterior ethmoidal, sphenopalatine and greater palatine. पहले तो ये देखो कि were these options given? I do not know. And what kind of picture was given? I also do not know. If this picture was asked, please look at this, because I have a doubt. I could not get the exact picture. Some people said that it was something like this which was asked, and then one more picture which people said that was there was something like this. So was it here just at the medial canthus, or something like this? Was this picture asked, guys? Please let me know. So this is the right image? This kind of a picture was asked where we are giving it at this. So they see there is a difference here. Perpendicularly given. Riya is saying it's a nasociliary one. See, nasociliary में different होता है. This is your nasociliary. So you have to learn accordingly. When you are doing the nasociliary, we are giving here, right? And when we are giving here, this is your anterior ethmoidal. So I do not know. Whatever was asked, you have to see. You have to see the difference. See, that is why I have included both the pictures, because I do not know whether it was this picture they had given the injection here, or they had given. Even though I know the answer, I didn't saw this question as I didn't manage the time properly. Oh, sad. That is why, you know, giving test is very, very important, because at times the problem comes even if you know you are not able to attempt this. So please give more and more tests, okay? It was anterior ethmoidal, not near the eyebrows. Acha. So it was this one. It was this. That means it was this one. So if it is near here, then it is the anterior ethmoidal. Number 1 picture is correct है. Hero number 1 है ना? अच्छा, उसके बाद see this. See this. Can you tell me what is this block? Now all the 4 options which are given there, we could know. So what is this then? Can you tell me? If they would have given you this picture, then what is this block? You should be ready for all the 4 options then. So Nana is saying, yes ma'am, this picture. Do you want to say this picture came? Yes, this is your sphenopalatine block. Sphenopalatine. This is your sphenopalatine block. Okay, then tell me about this. What is this block then? No, Sunaina, it is sphenopalatine. Yes. Number one was anterethmoidal. Then I showed you the nasociliary block. Then that was sphenopalatine. Okay, and what is this one? What is this one? Anybody who can tell me what is this one? This is your greater palatine. This is your greater palatine block. Yes, see this. This is your greater palatine block. So even if in future you get similar kind of a question, this is your greater palatine block. Okay? This is your sphenopalatine. Sphenopalatine ho gaya. Then if it is given here near the brows, then it is nasociliary. And as most of you are saying that it is this. So what is the answer here? So the answer will be your anterethmoidal, right? According to this picture, if this picture came, ठीक है ना? Subhashish, was this the picture or not? I think most of the people are saying that it was this picture and they were giving this injection here. So then it is anterethmoidal. So I have shown you all the 4 pictures. Now I have left to you that which picture came. I do not know, but most of the people give me this, that this was there. So this is your anterethmoidal. Okay? All right. Then there was a question on this. Now, I do not know if I could get the exact image, but it's quite similar to what you people told me. They said that the patient was having 9 gazes was shown and the central picture was having the ptosis. So this is having the ptosis here, and then they said that this patient is not able to see medially, not able to see upside also, not able to see inferiorly also. Then they also said that the eye that was shown was down and out. Down and out. So is it true or not? This patient is not able to see up. See, this eye is looking up, but this eye is not able to look up. Okay? Then this eye is looking down, but this is lesser. So it's not able to look down also. But if you see here, this eye is looking outward. So this is not adducting. So there is a problem in the medial rectus also. But both of them are abducting. So lateral rectus is normal here. Okay? So which eye palsy is this? I think this we have discussed so many times in the classes. This picture only. Similar image. Entire right eye. Entire right eye was closed by the eyelid. Difference that, I think you people want to say that the image was the similar one, but instead of the left eye, that was right eye. Okay, na? So, please give me the options. Answer everybody know, but I do not know what were the other options. The options, see the similar picture that I have also a similar kind of picture only, balki in my class notes and in the app, the picture that I showed you, that was the right eye only. Perhaps it could be this also. Perhaps this picture was given, I do not know, but because the picture that I showed you in the classes was the right eye only. Okay, na? So the options are your third nerve palsy, fourth nerve palsy, middle rectus palsy, or the sixth nerve palsy. So obviously the answer is your third nerve palsy only, where the eye is down and out, but I do not know exactly were these options right or not, because medial rectus palsy and the third nerve palsy, most of you have told me, but most of the students said that we did not even care for the other options and we simply marked this third nerve palsy. So please tell me if you remember the other options also. I am not sure of these options. Oculomotor है, trochlear हो गया. Then we have got the abducens हो गया. Optic nerve, Sunena, are you sure that they had given one option as optic nerve? I do not know if they are giving the optic nerve palsy in the motor nerve palsy and ptosis. So other people please comment if it was optic nerve. What do you think? Was optic nerve given? So please do let me in the comment sections know that was optic nerve there or not. I do not know if this was the option. Then again, question that was well discussed in the classroom. A patient was having some clinical scenario that was showing that the patient is having the anterior uveitis, like we were having the flare and the KPs. So this patient was having the acute anterior uveitis and only adduction absent. It was medial rectus palsy. But people told me that in the central image there was a ptosis, and the medial rectus palsy mein to there will be no ptosis. So please let me know if there was ptosis or there or not, because some of the students told me that ptosis was there in the central image, primary gaze mein. So that is why I took it as a third nerve palsy. So please do let me know. Was it a medial rectus palsy? Was there is no ptosis? Please tell me. Then there was a question on the acute anterior uveitis. RA saying ptosis was present. And then we are having a raised intraocular pressure. So this is actually the hypertension uveitis, right? So hypertension uveitis may when we are already having the inflammation, and if you remember I told you in the classes also that prostaglandin analogs can cause the intraocular inflammation. So in all those cases beta blockers are preferred. So what should not be used? What should not be used actually is the prostaglandin analog. So amongst the given options, like we have prostaglandin analogs, we have beta blockers, carbonic anhydrase inhibitors and the mannitol. The best answer will be your prostaglandin analogs, and I think most of you give this answer only. Yes? Ptosis was there, yes. Medial rectus, not optic nerve. So I think I have taken the right options then, hai na? Okay. Then next question. I think this is a very, very important question. But a very simple question that we have already discussed so many times. Safe strategy. Safe strategy, I always give you those handouts. Usme bhi class notes mein bhi hoti hai. And as I always say, trachoma is important because it is the most common infection which is causing the blindness in India. So what is the answer? Tell me now. Safe strategy includes all except surgery for trichiasis, A for antibiotics, F for facial cleanliness, facial hygiene, and E for evaluation of program. So yes, it's very clear. The answer is D. E is not the evaluation, it is the environmental cleanliness. Environmental cleanliness is there. So answer is the environmental cleanliness. So surgery we are doing mainly for the lid deformities. The most common is the trichiasis. A for antibiotics. Which antibiotic we are giving for the trachoma, by the way? Which antibiotic we are giving? Anybody? Yes. Superman, you are there? Yes. So which antibiotic we give for the trachoma, guys? Let me know. So antibiotic that we are giving, we can give the topical also and we can give the systemic. Topical mein we give 1% azithromycin, very good. Or we can give the tetracycline eye ointment, and or we can give single drug regimen 1 gram azithro orally, and that too once, and stat that you can give. This is your safe strategy. ठीक है? Okay. Yes, it is environmental cleanliness. Then again, a question that I do not know exactly. They said that a picture was given, medial rectus was marked, and they asked the nucleus is at the level of. Was it like this? I do not know this question exactly. And they said that the nucleus is at the level of, and I did not get the D option also. One was red nucleus, then inferior colliculus, superior colliculus. Please let me know if this language is correct, if this question is correct. Was there a similar question there? Because this question I do not know. We have discussed these things in the classes, but I could not know the options because very few people were telling about this question. Medial rectus was marked. So I think this image is correct then. Was it a similar image? Medial rectus was marked. So where do you expect its nucleus to be? What did you mark there? What were the options? Question is correct. Oh, thank you, Ji. Origin of the nerve. This question was there, but it was a CT scan picture. All right. So I'll replace it with a CT scan picture. It was a cadaveric image, axial section, medial rectus was marked. It was a CT scan or it was a cadaveric image? It's quite different, guys. This question was there, but anyhow cadaveric section था या CT scan था या जहाँ पर भी था, they marked the medial rectus. ठीक है ना? Now they had asked that where you are getting this nucleus of this medial rectus. So what were the options? Look at the options. Are these options correct? Red nucleus था. Red nucleus was at the level of midbrain. Cadaveric image थी. Red nucleus, fastigial nucleus. Okay, fastigial. And inferior colliculus, superior colliculus था. CT scan arrow pointing to medial rectus. अच्छा. Fastigial nucleus, red nucleus, and two more. So where do you get the nucleus of the medial rectus, by the way? What did you mark? Both inferior colliculus and superior colliculus दोनों ही नहीं थे. But somebody told me that either one was there. Colliculus was not mentioned in the options. Inferior olive level. अच्छा. It was inferior olive level. Is it something like this? Red nucleus है. Sunena, are you sure? Fastigial nucleus नहीं था. Pyramid decussation. 100% sure था. Rhombin cephalic isthmus. Okay. Rhombin cephalic isthmus. Pyramidal decussation था. बट मेरे हिसाब से सुपीरियर कॉलिकुलस होना चाहिए बिकॉज आंसर शुड बी सुपीरियर कॉलिकुलस. मिडिल रेक्टस इज सप्लाइड बाय द थर्ड नर्व एंड द nucleus is lying at the level of superior colliculus. Was superior colliculus not there in the options? Red nucleus था, superior colliculus था, pyramidal decussation, pyramidal tract decussation was there. So I do not know. There is a lot of confusion. But according to me, the options was should be superior colliculus because it is supplied by third nerve and that is lying at the level of superior colliculus. So still, there is a doubt here. There's a question mark that what were the options, and according to that we will have to decide. This I am keeping it for the review. Let me get all the 4 options for sure, and then I will again share the modified PDF along with the answer. But according to me, this answer should be the superior colliculus because the nerve is having that. Okay. Okay. So please give me the feedback on all these questions, and if you feel like that if this was not colliculus, then please give me the right option so that we can come up with the better answer of this question. And I think all the other questions are clear, and the options and the language was fine, and you were able to do it. Please don't be disheartened if you did something wrong, but because this is not the final destination, there is one main big paper yet to come, that is your NEET PG. And if you perform well, please don't be too much happy about it. Don't be complacent, because again, this is not the final destination. Please carry on with your good work and take it as a trial. Look at your weaknesses, do the strength weakness analysis, and this is a very good paper for seeing that where you are lacking, and fortunately you have ample time to work on your weaknesses. So I'll be coming live again in some days to discuss about what more we can do for the NEET PG, and how to analyze this your INI CET paper, how we can use this to our advantage so that we can perform even good, better and best in our NEET PG examination. That is how you should take it, and let's see what topics were weak, where you were lacking, or your theory is weak, your concepts are lacking, or your time management is lacking, and certainly use them to your benefit so that you can come up with your best version. Don't have a comparison with other people, have a comparison with yourself and come out with your best version, so that you do not have the regrets afterwards. Oh, I could have done this. That is the worst thing that could happen, that when you feel I could have done this but I have not done this. So there should not be any regrets. Yes. थैंक यू गाइज. आई थिंक मुझसे ज़्यादा तो अब मेरे स्टूडेंट्स बोलते हैं हैप्पी ऑफ्थेल्मोलॉजी. दैट इज सो प्राउड मोमेंट फॉर मी. थैंक यू सो मच. Ma'am, please provide the schedule for the revision for the next 50 days. All right. So very soon I'll be coming with the schedule for the next 50 days. Oh, that is not a problem. And yes, Rihanna, I would say yes. If you believe in yourself, and even today you start working and you are having 100% commitment, you can do it. Okay, don't even think of the other side. And 70% was easy, rest 30% was luck. Okay. Thank you so much. Thank you for Guru Purnima wishes. Thank you for your patience. Thank you for your cooperation in getting me the questions, and thank you for your patience and your participation this time also. You guys means a lot for me, and I am very privileged to have this session on the Guru Purnima days. Thank you so much for all your wishes those of you have sent to me, and I could not actually reply each one individually because you people have given me so much love on different platforms. So thank you so much, guys, and I too have the same regards and love for you, and take care. Very soon I'll be coming with the 50-day strategy also. Thank you, take care, and happy ophthalmology.